The thyroid gland is butterfly-shaped, with two lobes connected by an isthmus, and is located below the larynx, anterior to the trachea. In adults, it weighs 15 to 20 grams. It secretes thyroxine, triiodothyronine, and calcitonin, thyroid-stimulating hormone, or TSH, from the anterior pituitary, stimulates its secretions. Thyroid hormones are synthesized from tyrosine and iodine, which are consumed through the diet. Iodine is converted to iodide and absorbed from the gastrointestinal tract into the blood. Synthesis occurs in the thyroglobulin of the follicles. The first step is the synthesis and storage of thyroglobulin by the follicular cell, which is stored in the follicles. Then, iodide trapping occurs using the sodium iodide symporter and the NAKATP-ASE to concentrate iodide. Finally, iodide is oxidized to iodine by thyroid peroxidase, as only iodine can bind to tyrosine. Iodine is transported into the follicular cavity using the iodide chloride pump, or pendrin. Next is the iodination of tyrosine, which is the binding of iodine to thyroglobulin, called organification. This forms monoiodotyrosine, or MIT, and subsequently diiodotyrosine, or DIT. The coupling of MIT and DIT forms triiodotyrosine, or T3. The coupling of DIT and DIT forms tetraiodothyronine, or T4, also known as thyroxine. Reverse T3, which is non-functional in humans, is formed by the coupling of DIT and MIT. The thyroid gland can store large amounts of hormones. Each thyroglobulin molecule stores up to 30 T4 and a few T3 molecules in the follicles. This supply lasts for 2 to 3 months, delaying the effects of deficiency if synthesis ceases. T3 and T4 are cleaved from thyroglobulin before release. Follicular cells form pinocytic vesicles that combine with lysosomes to create digestive vesicles. Proteases digest thyroglobulin, releasing free T3 and T4 into the bloodstream. MIT and DIT are deiodinated, and the freed iodine is reused. In the blood, over 99% of T3 and T4 bind to plasma proteins like thyroxine-binding globulin, thyroxine-binding prealbumin, and albumin. Thyroid hormones activate nuclear transcription, leading to the synthesis of various proteins. T4 is converted to T3 to bind to receptors, forming a heterodimer with the retinoid X receptor. Thyroid hormones also significantly increase the basic metabolic rate by accelerating food utilization and affecting protein synthesis and catabolism, which increases growth in the young. In carbohydrate metabolism, thyroid hormones enhance glucose uptake, glycolysis, gluconeogenesis, and absorption from the gastrointestinal tract. In fat metabolism, they mobilize lipids, increase free fatty acids, and accelerate their oxidation, which decreases plasma cholesterol, phospholipids, and triglycerides. Thyroid hormones increase the requirement for vitamins, blood flow, cardiac output, and heart rate. Mild increases in thyroid hormones enhance heart strength, but marked increases can depress it. They also increase respiration, gastrointestinal motility, and nervous system excitation. Thyroid hormone secretion is stimulated by TSH from the anterior pituitary, low BMR, leptin, alpha-melanocyte-stimulating hormone, and decreased temperature. Inhibition occurs with excess iodine intake, stress, somatostatin, dopamine, and glucocorticoids. TSH increases the thyroid gland's activity and is controlled by hypothalamic thyrotropin-releasing hormone. Increased thyroid hormone decreases TSH secretion via a negative feedback loop, acting directly on the anterior pituitary and inhibiting thyrotropin-releasing hormone in the hypothalamus. Disorders of the thyroid gland include abnormal secretion of thyroid hormones, leading to hyperthyroidism or hypothyroidism, and goitre, which is an enlarged thyroid gland. Hyperthyroidism, or thyrotoxicosis, is caused by excessive T3 and T4 levels. Common causes include Graves' disease, overactive thyroid nodules, thyroiditis, excessive iodine or thyroid hormone medicine, and benign pituitary tumors. Hypothyroidism results from insufficient T3 and T4 secretion. This condition causes congenital hypothyroidism in children and myxedema in adults. A goitre is a swelling in the neck due to an enlarged thyroid gland. It is often associated with a thyroid that is not functioning properly. Calcitonin is a peptide hormone secreted by the parafollicular or C cells of the thyroid gland. Its role in humans is minor compared to parathyroid hormone in calcium regulation. It decreases plasma calcium concentration by decreasing osteoclast activity. increasing osteocyte activity and decreasing new osteoclast formation. The parathyroid gland consists of 4 small glands located on the posterior side of the thyroid gland. Chief cells secrete parathormone, or PTH. Oxyphil cells are degenerated chief cells. PTH secretion is regulated by blood calcium levels, increasing when levels fall. Its main function is to raise low blood calcium. It indirectly increases calcium absorption from the small intestine and reabsorption from renal tubules. If necessary, PTH stimulates osteoclasts to release calcium from bones. PTH and calcitonin work together to maintain normal blood calcium, which is vital for muscle contraction, nerve transmission, blood clotting, and enzyme action. Increased PTH stimulates bone resorption, increases calcium reabsorption in renal tubules, and is necessary for the conversion of 25-hydroxycholecalciferol, which increases intestinal calcium absorption. The disorders of the parathyroid gland are hyperparathyroidism and hypoparathyroidism. Hyperparathyroidism is the hypersecretion of PTH, resulting in hypercalcemia, which is increased calcium plasma levels. Hypoparathyroidism is the hyposecretion of PTH, leading to hypocalcemia, or decreased calcium plasma levels, which can cause symptoms like carpopedal spasm. Thank you for watching this video on the thyroid and parathyroid glands.